Welcome to this explainer. Today we're unpacking one of the absolute most critical, yet somehow least talked about tensions right at the very heart of modern medicine. We are looking at a massive, high-stakes balancing act between two huge forces, the creation of groundbreaking new drugs and actually ensuring those same life-saving treatments get into the hands of the people who need them most. It's a truly fascinating look at how the rules governing scientific information literally shape the future of global health.
Okay, let's dive into this. I want you to just think for a second about your own medicine cabinet. Or maybe, a prescription you regularly pick up for a loved one. Have you ever wondered what actually dictates the price you pay at the pharmacy counter? Like, what happens when the life-saving data required to make those exact medicines is legally locked away from the broader market? Well, the reality is, pharmaceutical data laws aren't just dry legal text. No way. They have a direct, tangible impact on your wallet, your healthcare options, and your overall access to life-saving treatments.
Which brings us to Section 1, the price of health and the invisible forces driving prescription costs. And that leads right into Section 2, the data protection era, which is causing a major disruption in the pharmaceutical landscape. So we're currently living through what experts call the data protection era. It's a massive, high-stakes tug-of-war happening completely behind the scenes. But to really grasp the mechanics here, we need to clearly define what data protection actually means in this specific context. Basically, it's a legal framework where original drug developers hold exclusive proprietary rights to their clinical trial data. This absolutely prevents generic manufacturers from referencing that exact same data to get their own, more affordable versions approved. Think of it kind of like this. Imagine you just spent years inventing this incredibly delicious, groundbreaking recipe for a cake. Data protection is like being legally empowered to keep the exact measurements and baking temperatures a total secret. Nobody else can bake that exact same cake until your protection period runs out, even if they have the exact same basic ingredients sitting right there in their kitchen.
And this brilliantly illustrates the core tension at play here. On one side of the scale, we have the original innovators, often called Big Pharma. They invest billions of dollars and literally decades of research into developing these cures. And they argue, very understandably, that they absolutely need to protect this data. Why? To recoup those massive research costs and to incentivize the creation of tomorrow's cures. If anyone could just copy their homework immediately, why would they spend the money to do the research in the first place, right? But then, on the flip side, we have generic pharma. They're advocating for the public's immediate need to access that data. Their goal is widespread accessibility, aggressively driving down consumer costs, and really ensuring global health equity so that life-saving treatments aren't just a luxury for the wealthy. Both sides are presenting incredibly valid, absolutely critical arguments that are shaping the entire future of medicine.
Moving into Section 3, generics as the affordable lifeline and the anchor of global health equity. If data protection is the shield for new innovations, well, generics are the affordable lifeline for patients everywhere. When we talk about generic medicines, it's so crucial to remember exactly what they are. They deliver the exact same clinical benefits, the same safety profile, the same efficacy as the original brand-name drugs. They just do it at a fraction of the cost. For millions of families around the world managing chronic conditions, things like diabetes, heart disease, asthma, these generic options aren't just convenient. They are a vital, non-negotiable lifeline. In fact, a surprising reality is that generics save healthcare systems trillions of dollars every decade. Trillions. Without them, people are quite literally pushed into financial ruin.
Because of all that, when we look at the entire global healthcare ecosystem, cost-saving generics represent the undisputed #1 priority for accessible healthcare. The sheer volume of generic prescriptions dispensed globally is absolutely staggering. Without them, healthcare systems around the world would instantly collapse under the financial weight of brand-name prices. It's a real game changer. So, the absolute key takeaway here is that ensuring a steady, unimpeded pipeline of generic drugs is the single most important factor in keeping healthcare affordable for everyone, everywhere.
Which brings us to Section 4, a warning for generics, featuring a critical perspective from Dr. Reddy's Laboratories. But that vital pipeline, it's currently facing a massive threat. Now, what's really interesting here is a stark warning straight from our source material today. Just listen to the absolute urgency in the words of Satish Reddy, the chairman of Dr. Reddy's Laboratories, which is one of the world's leading multinational pharmaceutical companies. He says, generics must not be imperiled over data protection. Let that sink in for a second. This isn't just some mild corporate concern. It is a profound warning from a major industry leader that the strict legal mechanisms used to protect pharmaceutical data are actually threatening the very existence and efficiency of the generic drug market. The gravity of this threat literally cannot be overstated. If generics are imperiled, our access to affordable medicine goes right down with them.
So, let's methodically break down exactly why generics are so severely imperiled by these stringent laws. First off, these frameworks essentially create extended monopolies for original creators. By locking up the clinical trial data long after the initial patent might expire, it basically builds a secondary wall preventing competitors from bringing an alternative to the market. Second, and directly because of this wall, we see massively delayed market entry for affordable alternatives. Every single year a generic is delayed is another year patients and healthcare systems are forced to pay premium monopoly prices. Third, this causes a severe disruption to global health access. This is particularly true in developing nations that rely almost entirely on a steady flow of inexpensive generics. And finally, the whole shebang stifles overall market competition. Competition is the main engine that drives prices down in any industry, right? When data laws act as an insurmountable roadblock, well, that engine stalls out completely.
Bringing us to our final part, Section 5, Balancing Innovation and Access in Walking the Razor's Edge of Pharmaceutical Policy.
This whole dynamic leaves policymakers worldwide walking a very precarious tightrope. We are constantly trying to balance the undeniable need for ongoing medical innovation with the fundamental human right to accessible, affordable care. Let's move to the specifics and see how this builds into a balanced policy relying on 3 crucial steps. Step 1. Incentivize breakthroughs. We absolutely must maintain systems that protect intellectual property just enough to reward the brilliant scientists pouring billions into finding cures for things like cancer, Alzheimer's, and rare diseases. Step 2. Ensure timely access. Once a reasonable, defined period of exclusivity has passed, the pathway for generic manufacturers to use that data and enter the market must be clear, efficient, and unobstructed by legal loopholes. And Step 3. Protect global health. Any policy made at a national level has to consider its ripple effects across the entire globe, ensuring that protecting data doesn't inadvertently shut off the medicine supply for the world's most vulnerable populations. It really is the ultimate test of balancing protected data with delivered doses.
Which brings us to our final thought. The tug-of-war between data protection and generic accessibility isn't going away anytime soon. Actually, as modern medicines become more complex and data-driven, it's for sure only going to intensify. So I'll leave you with this question to ponder long after this explainer ends. How do we reward the medical breakthroughs of today without sacrificing the affordable cures of tomorrow? It is the multi-billion-dollar question sitting right at the heart of global healthcare, and the answer policymakers land on will inevitably affect every single one of us. Thank you so much for joining me for this look into the pharmaceutical landscape, and keep asking those big questions.